Good morning, everyone. My name is Zinaida Shakel. I'm a PhD student from University of Porto, from Faculty of Pharmacy. Thank you, the organizing committee, for this opportunity to present my work here. Today, I will talk about hyaluronic acid load in the transetthosome for skin delivery. Hyaluronic acid is a well-known compound which you can meet in daily routine cosmetics, and it has a key role in tissue regeneration, inflammation response, hydration and wound healing, and even anti-aging and UV protection. Also, hyaluronic acid used in medicine, for example, it as artificial tears to treat a dry eye or to cure osteoarthritis of knee via intra-articular injection. Hyaluronic acid is a common ingredient, as I mentioned before, in skincare cosmetics. It is also used as a dermal filler in cosmetical surgery. Chemical structure of hyaluronic acid is a glycosamine glycan, which has a big size of molecule. Right? Big size of molecule, it's around 5 to 20,000 kilodaltons. And because of that size, it has low permeability to skin. And the outmost layer of skin don't allow permeate hyaluronic acid due to their size. And it stay on the skin, on the top. The main challenge here is deliver hyaluronic acid into the skin. Here I will explain briefly a structure of human skin. As you know, human skin is made of 3 layers. Main is epidermis. Most present cell in epidermis is keratinocytes. Then dermis here, and here is a main cell fibroblast, and hypodermis is like fat tissue. Epidermis is subdivided into 5 layers. Most interesting is stratum corneum, which is formed by dead flattened keratinocytes without nuclei, called corneocyte. They have major role in barrier function. And because skin is largest human organ, it's also interface between body and external environment. It mediates thermoregulation and water balance. Also, skin can be used as a drug or bioactive route for administration due to large size, and it can be painless because it can be self-medication, self-administration, and possibility to avoid first-pass metabolism. What we know about skin penetration. There are 4 main pathways to enter drug or active chemicals into the skin. First is a penetration between corneocyte, which I mentioned before, via intercellular lipids. It's here, it's most important pathway. Also exists in transcellular pathway. It's going through the hair follicles. First one, intrafollicular pathway is going through the hair follicles, and here transcellular, which is going directly through the cells, and polar pathway using polar pores on the skin. But to penetrate the skin is not easy process. There is many factors which affect on that process. For example, it's molecular mass, concentration, solubility, variation of pH, co-solvents, temperature. That is a physical chemical factors, and also biological factors as age, condition of skin, metabolism of skin, hydration of skin, and skin compound interactions. Also, there is a possibility to cross stratum corneum with micro injection. You can find on beauty market specific procedure called biorevitalization, whose primary purpose is delivering active ingredient, mostly hyaluronic acid, into the skin to improve their appearance. But in the reality, it's quite painful procedure and has a lot of side effects, such as skin irritation, it could be infection, or so on. And our task is avoid that needles and pain and get effective treatment. Right? That's why we decided to load hyaluronic acid in specific type of liposomes. Liposomes, it's formed mainly by lipid. In our case, it's egg phosphatidylcholine, which has polar head and lipophilic tail, which form bilayers structure. And our transetosome called liposomes, it's a common name, but we want to do it that liposome more deformable. And that's why we introduce ethanol and H activator to the structure to make this liposome more flexible, to better penetrate the skin. Also, we decided to choose two types of hyaluronic acid, smaller molecular mass and bigger one. And we see the impact on structure later. And I will talk about preparation. Preparation of transetosome, or in other words, deformable liposomes, made by thin film hydration method. Briefly, the lipids and H activators are dissolved in organic solvent. Then solution is evaporated in raw vapor to form lipid film. Then film is hydrated with hyaluronic acid solution and vortex to get a vesicle. Then we added ethanol, again vortex, and we get big size vesicles, which we are decided to decrease by sonication method. Here you can see some results which we obtained by dynamic light scattering. We choose, as I told before, two types of hyaluronic acid, small molecular mass, green one, and the bigger molecular mass is a blue one, and also jojoba oil and twin 80 as an H activator. And we can see that hyaluronic acid with bigger molecular mass has impact on size of transettosomes. Also, twin 80 has impact and creates smaller transettosomes with completely same methodic procedure. And zeta potential also have influence here with big molecular mass of hyaluronic acid. We have more negatively charged particles here. In terms of all zeta potential, we could say that we have good charges which are repulse our nanoparticle from aggregation. All that study was performed during 10 weeks, and I could say that particles are stable during that time. Polydispersity index is more than 0.2. We cannot say that it's homogeneous suspension, but it's caused because of we use sonication here. We know that if we increase time of sonication, we will have more uniform and homogeneous suspension, but we will have really small particles. We don't want to decrease so much particles. Last column, it's a determination of incorporation efficiency. I will inscribe it a little bit in details. We perform this analysis by separation nanoparticles from solution by Amicon tubes. And here on the filter, we can see our nanoparticles, and we do direct quantification by HPLC chromatography. And we can see that in 3 types of transettosomes, we have really nice incorporation efficiency, around 90%, which is really good. But in one type of transetosome, it was quite mystery because I cannot quantify here no hyaluronic acid. I cannot see peak in our transethosomes. That's why I decided to do indirect method, see where is my hyaluronic acid, it's disappeared. And I found out that hyaluronic acid is in solution, but no in transethosomes. This could be explained that jojoba oil make a membrane of liposome so fluid, which is create leaking of small mass of hyaluronic acid, because with bigger mass, I don't see that problem. Then we decided to make nanoparticle tracking analysis. We made it to confirm size distribution and also visualize the particles. You can see video here. The nanoparticles is in the water, they moving with the flow, and we can see them, like the explanation of method. We have thin tube with a flow of nanoparticles, really diluted, and laser, which is to visualize with microscopy nanoparticles. And also result is comparable with previous, which I have from DLS analysis, and composition with twin 80 and small molecular mass has smaller size here too. Next, our step was to choose a skin model to see how our nanoparticles is permeated to the skin. For that, we choose pig ear. It's a animal model, which is really relevant, has good correlation with human skin. It has similar dermal epidermal thickness ratio, also hair effulosis and blood vessel density, compositional stratum corneal, ceramides especially, dermal collagen and elastin, and origin is from animal slaughtered. Is we don't need to ethical improvement for that. And I will briefly explain how we do that assay. We use front diffusion cell, and here we have bottom compartment, top compartment, and skin between, and also a ring to make this system more hermetical and clamp to hold the system together, and water bath to maintain temperature, which is closer to skin, is around 32 degrees. And we introduce our compound here in suspension. Bottom compartment contain a PBS buffer, and we have steering, control temperature, and we can see with time, for example, with specific time point, we can remove a sample and analyze it and see how our substance permeates through the skin. Here you can see really preliminary result. Our task here on that table, you can see for formulation, top compartment corresponding for first line. Most of our formulation is on the top of skin, is not permeated. I did a say only for 6 hours. That's why it's really, really preliminary results. And pink layer, what is retaining in the skin. And the last column, what is passed through the skin. We can see that here most our formulation on the top don't want to cross the skin barrier, but here we have little bit improvement, and we're gonna work on that in future. What I want to say, how we analyze this, we use directly a probe from here and go to HPLC, and skin were digested and then extracted all compound from the skin by ultrasound and centrifugation, then evaporated. We form that lipid film here and added mobile phase, and then we quantify amount hyaluronic acid inside the skin. Second assay, we decided to do cell viability. We choose keratinocyte because it's major cell of epidermis. It make about 90% cells in that area. We choose commercial one line is HASAT. Cells were grown in the incubator and then seeded in 96 well plate with specific density, grown during night to form monolayer, and then our suspension with transetosome were applied on the cell and also some controls. Then we performed MTTSA to see which cell are more viable, and then we use microplate reader to confirm intensity of absorbance. And the results are here. I could say that transetosome with concentration of F-phosphatidylcholine, which is main component of transetosome, of 0.5 is good for cells, and also high amount of hyaluronic acid also is safe for cells, for keratinocytes. But what we could see here is that hyaluronic acid with small and big molecular mass could promote growth of cells, of course, and the presence of ethanol in our composition could be dangerous for our cells. That's why probably in future I will modify this in my transettosomes. As a conclusions, I want to say that obtained nanoparticles has good storage stability up to 10 weeks and good hyaluronic acid incorporation efficiency, more than 97% except first formulation. And the size of transetosome is suitable for skin application because they're small and save the keratinocyte with F-phosphatidylcholine concentration below 0.5 milligram per ml and big amount of hyaluronic acid. As a future perspective, I want to optimize of the size of transetosome and their homogeneity, and we will select a vehicle for increased skin retention because we want hyaluronic acid inside the skin. We don't want to cross it deeper, just retaining skin to have that good properties of hyaluronic acid. And also probably decreasing ethanol content to make transetosome less toxic for keratinocyte. And next assay is viability assay for fibroblast, which is really good, has a good result for skin. And I want to thank my supervisor, Professor Salat Reish and Dr. Sofia Lima, and my colleagues from MB2 laboratory from Faculty of Pharmacy. Thank you so much for your time and attention. Do you have any questions?
Anyway, thank you for your presentation and your way of present your work. And good luck for the future work.
Okay, thank you so much.
Thank you for your time.
Thank you.
Thank you.
Bye-bye.
Bye.